Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name is Julie. I'm married to Alf, who was diagnosed with head and neck cancer in 2010. He had surgery in 2011, and I'm here to give my views on what it's like to be the partner of somebody with cancer.
Julie, thanks for coming in today to join us on the Cancer Stories programme. Not many family members have been with us to tell their account, but I think it is an important area, one that we don't want to overlook. So it'd be very useful for the viewers and myself to hear how things are from the perspective of the significant other, the person who's around the person themselves with cancer. A few words on your partner Alfie first, if I can mention his situation. So he was diagnosed with a head and neck cancer, isn't it?
Yes, in 2010 December, and then he had surgery in February 2011.
Yeah.
We're 3 years down the line, and he's just had another cancer removed from the neck, and yesterday we were told that he's now got some cancer over on the right hand side of the neck, which they won't operate on, so he will have to have chemotherapy and radiotherapy.
Okay, so he's really been through it.
Yes.
In all honesty.
Yes.
And he's currently facing a big challenge right now.
Yes.
And he's had various setbacks, and he himself has recorded his own story.
Yes,
it's part of the Cancer Stories programme, and it's very a very inspirational and popular account, because people can see on that video how determined he is despite his own setbacks, you know, to cope with it. That's his medical side, but what's the story of your relationship? When did you two get together?
We've been together nearly 22 years, and we met through work. We'd both been previously married and were divorced, and this year we've been married for 20 years. So I intend to have a very good holiday when we get to 20 years.
Yep.
Alf is a Jack the lad.
Yep.
He doesn't let people always see the other side, which is when he's not well, he'll always smile and say, I'm okay, when he's not. And I'm the one who deals with all of that. And anybody else who's been in this situation will be doing exactly the same.
Yes.
From my point of view, I don't feel that as a carer we have any support. We left the hospital and they never told me what to do. You know, they just say, if you have any queries, phone us. And it was like, well, what do I do? They showed me how to clean his peg, his feeding tube, and just left us to it, really.
On which occasion was this?
This was the first time when he had the main surgery, the big one.
So, I mean, I'm hearing it. It sounds like the hospital's taking a rather passive approach. In other words, if you really need us, kind of give us a call.
Yes.
But it leaves you with the problem. I mean, to use that word, it sounds extreme, but you're the one that is actually helping look after somebody who's just had their surgery, I suppose, and just about ready for discharge. Did you feel he was discharged from hospital at the right time?
No, I think he could have stayed in a little bit longer because he had problems with the tracheotomy, and it affected him very badly.
Yes, he told the story to us of when it was blocked on the ward, and he got a massive shock from that.
Yes, he did.
It did shake his confidence.
It did. And for 6 months he slept in a chair because he was scared that if he got into that bed he would die.
Yeah.
And for 6 months I had the door open and watched him sleep in a chair, and that is not nice. You know, I wanted my husband in bed with me. You know, but I supported him through it because it was the only way that he got any sleep.
So there was definitely a kind of psychological and emotional side to your and his account.
Yeah.
Going back right to the basics of when he was originally diagnosed and treated, did you feel that you were involved in that process? Were you attending with him, and were the medical team involving you appropriately, giving you information? Yeah,
I went with Alf right from the beginning. And I think I've attended just about every appointment that he's been to make sure that we both understand what's going to happen. And I had no shocks when he came out of surgery because of how they described it was exactly what I saw. So I wasn't shocked. And the nursing staff have been very good. In the maxillofacial clinic, I think they're very thorough.
Yeah.
And we have had the support with the dietitians and the speech therapists, and obviously with yourselves.
Yes, because often in a head and neck cancer it requires more than one specialist. It's a multidisciplinary team who's adding into, you know, helping somebody out.
Yeah.
But I'm interested that you were involved, you know, during that process. Do you think that the carer, the family member, has an important role in prompting the patient who's going through that, you know, that difficult journey initially? In other words, you know, sometimes if you imagine the patient attending on their own, it's hard for them to take in all that information. It's hard for them to make decisions, you know, based on what are the pros and cons. Do you think even in that early stage you had a role in that sense, or was he very much autonomous, i.e. a decision maker himself?
I think for both of us, because it was such a shock to discover that he got cancer, that we both came away and then we sat down and went, well, okay, we have to deal with this now. So each time we went, even if Alf had a doubt, I wasn't going to let him have a doubt, because at the end of the day, he's my world.
Yes.
And he's not going anywhere, not soon.
How much was he relying on you then?
Oh, quite a lot. Quite a lot.
Even at that very early stage?
Yes. Yeah. And throughout all of it, throughout the whole of the last 3 years, you know, I've supported him and made sure that, you know, he keeps going, that he eats, drinks, does his exercises and everything, you know, because he would quite easily sit down and not do it.
Well, that is a role that really comes to the fore when somebody's discharged from hospital and they've got certain things that they should do to maintain their health. But perhaps that multidisciplinary team is not so hands-on. Somebody, yourself probably, if they can step in then and supplement what the hospital is not doing, is fulfilling a very, very important role, I think.
I think, to be fair, that once the hospital discharge you, they just assume that you will do all of these things yourself anyway. And I honestly think that if somebody lived on their own, that they wouldn't do half of those things, you know, and you feel sorry for them because it's a long journey, and they probably wouldn't cope on their own.
No, I think you're right. To have the a family member who's appropriately pushing you, it can be a big help. But there comes a point, and I don't know whether you recognise this, I'm sure you do, when if you push too hard, they can get irritable or push back.
Yes.
You know what I mean?
Yes.
You've got to choose a balance, haven't you?
Yes. I mean, there have been times when we've snapped at each other, you know, and then we end up crying because we realise that we shouldn't be snapping at each other, but it's only because of, as we say, that horrible illness, cancer, and what it's doing to us.
Yes.
Well, more, I mean, Alf's the one that's going through the surgery and the treatments, but I'm the one, if you like, his punch bag, you know, and I mean that in the nicest way, you know. It's not that he means to do it, and I don't mean to have a go at him, but sometimes it just does, it gets on top of you.
Now, you said that he has a certain image that he portrays to the outside world, but you don't necessarily just see that, you see the true him, don't you? And that means if he is irritable, stressed or upset, you probably see that more than anyone else. How do you manage that? How do you cope with that if you see him being stressed by, you know, what you know he's undergoing?
That's a difficult one. Sometimes I'll try and sing, which doesn't go down very well. We always try and talk about everything. And that's the key thing, is to discuss, you know, what's wrong, why we're in this mood. Because if you don't talk to each other, you know, and I think the other thing as well is plenty of hugs.
So you're pretty open with each other, and you're still trying to maintain the warmth and intimacy together, which is very important, I think. And sometimes either of those, communication or intimacy, can be lost. In fact, one of the battles through an illness is to maintain something of your roles in terms of how the relationship was, as much as how it is. I can ask you perhaps more on that by asking you whether your role, you feel your role has changed, you know, your role in the relationship. Does it change as the illness evolves?
It changed in the first instance, I think, because obviously you're so wrapped up in the treatment and getting him through the surgery and then getting him better. But then your marriage kicks in, you know, he's still your husband and you love him. So that's, it just continues, you know. I mean, even yesterday when we'd had the bad news, last night we went out for a meal. You know, we still do our things together. Was that something you pushed him to do? No, Alf told me we were going out for a meal. So sometimes he can be the one giving you a little push and encouragement. And sometimes it can be you. I think we bounce off of each other really well. It's a two-way thing, isn't it? I think people forget that, you know, when you're in a relationship, you're not just the carer for them. They're supporting you as well. Absolutely. I come home from work some days and it's me that's crying, you know, and Alf gives me the hug and the love that I need. So we're good together. Now, do you have any tips for the viewers about how to maintain your relationship in the face of an illness? How to keep some big aspects of normality going? What you said, what you do, which is, you know, the warmth, the communication, and that's really key. But how do you maintain it? What do you do to keep the illness from being too intrusive in your lives? To be fair, it does take over your life, and it is hard to find that balance. But I think once you get past the initial surgery and you get to the point where the person feels comfortable about going out, which a lot of patients don't to start with, then you have to push and sort of try and say, right, it's now time to do holidays and visits, and that's when you have to try and start your life back on track again. So you just need to find a balance, but obviously everybody's balance is different. But for Alf and I, ours is pretty good. With Alf, he's had a head and neck cancer, and that's one particular cancer where his confidence and self-esteem can be affected. You know, that's quite a powerful thing.
Did that itself intrude into the relationship, meaning that his insecurities about how he looks, how he feels after the operation, did that come into it?
Yes, it did. Alf, even to this day, will tell you he doesn't like the way that he looks. To me, he's still my Alf. He always will be. But it took him quite a while to feel comfortable with going out. He does have some really good glasses which cover you can't notice that he hasn't got the eye there. I think there's only once when we've been out, and because he drinks through a straw, he did get a little bit ratty because somebody looked at him funny. But he soon calmed down. But sometimes he does feel uncomfortable, but I think over the time his confidence has got better, because a lot of people will say, I didn't even notice you hadn't got an eye because the glasses are so good.
Now, tell the viewers and myself how it affects you personally to see that change in his image more than, I'm not talking about his behaviour, his personality so much, I mean the image. Do you personally get used to it quite quickly? In other words, does your brain kind of adjust to the fact that that appearance has changed?
Yes. I mean, I don't notice that Alf hasn't got, that he's lost his eye.
Yeah.
And for me, it happened quite quickly. And I think because when they told me what the surgery would involve and how he would look, as soon as I walked into the ward that day and I saw him, and I just thought, oh yes, it's as they said it would be. So to me, it's no different. So
does it mean that then it's unusual for you to think there is something wrong or changed in his appearance? Wrong is the wrong word. It's a change. Is there something, does it require somebody else to be staring to think, oh, what's going on there? Do you know what I mean?
Yes, I mean, like I say, I don't really think about it, but I suppose if somebody does stare, and then I would think, well, probably they're just having a look, because obviously now he's had his one on his neck, surgery on his neck.
Yeah.
They're probably having a look at his neck more than anything. But I honestly say it doesn't bother me and I don't notice it.
Now, imagine other relatives, family members watching this in relation to their loved one who might be coming up for surgery and they're worried about how they're going to cope with the change in that person. What would you say to them?
That person is still the person that you're married to, or it's your mum or your dad. You love them, nothing changes.
You think they'll adjust to it and they'll be able to accommodate to that change quite quickly?
I would always hope that anybody would that goes through what we've gone through.
Yeah. Now, what about these difficult questions about the future and how to handle uncertainty? Because the patient is the one undergoing the procedure, but both of you are living with the question, what's going to happen in the future, how are things going to go? You might even have different views from time to time about what is or isn't indicated. So what's your personal view on how much you can appropriately think about the future? I mean, can you be worrying too much about the future and dwelling on it excessively, for example? No.
Every day that we have together is a bonus.
Yeah.
And with the last diagnosis, we've both gone away, and Alf said that he's not ready to go yet. So he will have the other treatment.
Yeah.
Because he wants to spend as much time as he can with me. So all that says to me is that, like I say, every day is a bonus. We don't think about the future because we can't. We will just continue. I will push for him to have every treatment possible, but when he says to me, Julie, I've had enough, then I will respect his wishes.
Yeah.
And at that point, then we will look at things differently, but not at the minute.
Okay. Do you have a way that you can resolve differences between you? Do you have a way where you can come to a mutual agreement if one person wants X and the other wants Y?
I think in this case, we both want the same thing.
Yeah.
So there's no argument with it, because obviously I want Alf here with me always. And because when we came out, he said, I'm not ready to go yet, we'll fight it.
Yeah.
So we're both on the same path.
What's been the reaction of your own colleagues at work or your friends or extended family to the situation you find yourself in?
Very shocked, especially for the fact that it's gone to the other side of his body now. And all they can do is send their love, send their support, and we know that with any of them, they're always there for whatever we need. But it doesn't change anything, you know. We're still Alf and Julie, and we always will be. You know. Do you
feel that the support you get from the extended family and friends is important to you?
Yes. I don't think we would get by without it. I think it's utmost in the healing process, because obviously if there are times, if I step back and say, you know, I'm finding this hard, there's always somebody that I can talk to within the extended family.
I was going to ask you that, and particularly ask you whether there's time for you to have quality time that you can still appreciate. You know, in a normal relationship, you wouldn't necessarily be always together 24/7. There might be times when you had your own interests, and I know one thing that's very admirable, but I'm sure it's a personal choice, is to maintain your work so far. You've been able to do that, haven't you? What do you think is the importance of maintaining your own independence?
It takes you away from the illness for the time that you're not with it. Also, it makes Alf look after himself, because he is capable of looking after himself and do everything for himself. If I was there 24/7,
yes, that's a very good point.
He would just sit back and think, you know, oh, Julie can do it.
Yes.
In the nicest possible way.
I agree. There's a danger that the carer can be too accommodating.
Yes. But for me, I need to be with other people as well. Alf has his golf, which he goes up there 3 times a week, and then sometimes if he'll work in the golf shop. So I do my work, and I do swimming. And that's the way that I relax, and I have some time on my own. But you need some time away from each other to maintain your relationship and just to have a little me time.
And do you have to work on that, or is it a routine that you'd already developed?
No, it's a routine. It's just, as I say, I work full time. And Alf's always done golf even before he was ill. So no, we don't have to work at that one. But it is important to have a little me time.
Yes, I totally agree with that. I totally agree with that. Where, how, looking back on the whole time that you've spent together before and after the illness was diagnosed, how do you reflect on how the relationship has been, the quality of it, and whether there have been any significant changes, or whether you've been able to maintain it the way it was before? What's your overall reflection on how the illness has impacted upon you?
I think if anything, it's probably brought us closer. I mean, we were close before, and we've, soppy as it sounds, we are in love, and we always have been, I think, from day one. But I would give my life for Alf. If I could swap places with him, I would.
Yes.
And I think really, I don't know, there's just not enough hours in the day some days to have enough time together. You know, so every day is precious, and we'll just continue.
I've got one final question for you, and that is, do you think that services for relatives, family members, could be improved and enhanced in the way care is organised in the NHS particularly? In other words, could we be doing more for people in your shoes in the future?
Yes.
And how could we do that? How could things be organised in a way that was valued, effective, but available?
I think once people are diagnosed, the person that has the cancer is then sort of put through the system, and I think at that point or just shortly afterwards, if there was a support group for the person that's going to be the carer, could meet other people that have gone through it, so you know what to expect, or to give you some insight into it. And also afterwards the surgery, because Alf goes to different groups,
Yes.
I think there should be something for carers or relatives, just so that they have time away and they can support each other.
Yeah, I think that's a brilliant idea. Yeah, as you know, it's one thing we have been looking to develop but not yet put into action locally. And I've heard of some other centres where that is available, but not here right now. So I definitely take that on board. Do you think that meeting or talking over the phone or online would serve a similar purpose, or would it be more powerful to get together?
I think it would be more powerful together, because not everybody likes dealing with computers, and some people can't talk over the phone very well because it just seems a little bit too formal. Whereas if you were sort of sitting down having a cup of coffee with somebody, it would be a lot easier, I think.
And what about a one-to-one support system? Some people call that buddying or mentorship, where you would get linked with in your case, a relative of another patient who you'd meet for coffee, like that.
I think that's a good idea as well.
Yeah, and I've heard of that system for patients. I'd love to see that system for relatives too.
Yes.
Because from what you've said today, you've overcome together, you and Alfie, an incredible amount of challenges, and you've maintained a lot of quality, warmth in your relationship, and you've actually helped each other. You know, it's been a two-way process. All those things are positive and speak to the advantage of having a loving relationship that you've got when a challenge comes along. But it also speaks to the importance of maintaining it, to working on it through that process. So thanks for coming in today. I really appreciate it.
You're welcome.
I'm sure the viewers will find it useful.
I hope so.
Thanks a lot.
Bye.